Hello everyone and welcome. My name is Caroline Lennon-Nally. I work with the National Quality Improvement Team and I'm also a member of the Q community. We'd like you to know that this session will be recorded and also that the text chat will be saved. If at all possible, we'd love if you can leave your camera on, as it would be really great to see all your lovely faces. I would now like to introduce you to Dr. Philip Crowley, as he wishes to personally welcome everyone to this milestone event today, which we're celebrating in a different and unique way as a result of the challenges of the pandemic and the cyber attack on our health services. So over to you, Philip.
Thanks very much, Caroline. Very nice to see everybody. And to have so many people participating shows, I think, not only the way that I think we're embracing the Q community, but also the way that we're in embracing it, we're participating in it as well. Because I think that's the key, isn't it? That we become part of this wider community, we share knowledge with each other, we share experience and expertise. And we only really do that by actually not just becoming a member, but by participating. And so it's lovely to see so many people here today. And I'd like to welcome you all very much to today's celebration, which will just be an hour and a half duration. And in so doing, I'd like to really note, I suppose, our friends in the North, as the television series was titled, HSE QI team in Northern Ireland, who were really very instrumental in kind of encouraging us to become members of the Q community and working with the Q community to enable the broadening of the Q community's kind of membership to include the Republic of Ireland. So it's lovely to be a member of the Q community, and I'm really looking forward to today. And I'd just like to welcome everybody to what will be a very nice event. Thank you very much.
Thank you, Philip. And I believe it's important for me to share with you all here today that it actually was Dr. Philip Crowley and Dr. Maureen Flynn's vision and foresight that resulted in Ireland becoming part of the Q community, along with the excellent support and really welcoming attitude from those leading Q. So we'd now like you to invite you to say hello by inserting into the chat box your name, where you're working, and also if you'd like to tell us if you've planned a vacation or a staycation. So 3 pieces for you to do: your name, where you're working, and if you've planned a holiday. That just gives us a little sense of everybody who's here with us today, where you're working and what fun things you have planned over the next couple of months. And so as you're doing that, actually, we thought it might be helpful for you also to be aware of the objectives behind this celebrational event, which underpin our hopes for our time together today. We want to grow people's understanding of the benefits of Q and what members can contribute to and receive from Q membership. Make new connections through conversation, listen to colleagues, share where you're at and what you aspire to do, finding ways to help each other and to help us to spread the word in promoting and bringing new members to Q. So I'm struggling here to see what's in our chat. Let me just see. Okay. We've Cleo from the Health Foundation, Tracy White, Dawn is saying hello to us from HSE QI in Northern Ireland. We have Veronica Hanlon from our National QI team, Cams in Belfast, Christina from Harold's Cross. We have Ursula Clark from the Kent, Surrey, Sussex Patient Safety, Deirdre Lang from the sunny Southeast. And the list goes on. It's really great to see everybody, here today. That's wonderful. So our plan for today basically is to set the scene for the celebration of Q's first year in Ireland. We also want to make sure that you get a chance today to connect with each other. So we'll have a total of 2 breakout groups. The first breakout group will be to explore what you know about Q. We'll be showcasing just 4 of Q's great opportunities. And after those brief presentations, we'll invite you to move into a second breakout group where you'll find a little bit more about your particular opportunity that you would like to know more about. Then we'll invite you to complete a poll to give us a sense of which of the opportunities you'd like to try next. Amanda will help us to explore where to next, and Priya will be showing us how to get invested in Q. We'll be inviting Dr. Philip Crowley to bring our time together to a close, but we'll also be inviting you to tell us what worked today and what might have even worked better. But now I'd like to hand you over to Dr. Maureen Flynn, who's going to set the scene for us for the celebration of Q's first year in Ireland. Thank you, Maureen.
Thank you, Caroline. And good morning, everybody. And hello, my name is Maureen Flynn, and I'm a Q member. It's a really great joy to be with you today to celebrate together our very first year of membership of Q in Ireland. But let's go to where it all started. Priya, next slide. Thank you. Q is a connected community now of over 4,500 people, all with a passion in QI, spread across 5 countries. Q have detailed terms of reference, but boiled down, the aim is to make it easier for people to share, learn, and collaborate in order to support sustainable improvement in health and care. In true QI approach, Q was co-designed. I remember it well. The conversation started in 2014. At the time, Jennifer Martin, were fellows of the Scottish Patient Safety Programme. And we felt a little bit envious because we were in Ireland. We couldn't join the co-design team. But more anon. The National QI team, on behalf of the HSE, became a partner country, as Philip mentioned, with the Health Foundation to make Q membership possible in Ireland in 2020. This was first announced at the All Ireland QI and Schwarzrand conference in Dublin Castle on the 18th of February, just last year. The National QI team has a memorandum of understanding, an MOU, with the Health Foundation for making a 10-year commitment for ongoing collaboration and support of QI. We provide yearly financial support to the Health Foundation and coordination of Q across Ireland. So what that simply means is, to anyone in Ireland who wants to join Q, it's free. So there's no cost barriers. So moving into our next slide, we're using measurement for improvement, our measurement for improvement skills, to show the growth of the Q members in Ireland. Thank you to Gráinne Cosgrove and our Evidence for Improvement team, who are helping us plot the chart. So here you'll see a line graph plotting the journey from our first member, which was the 29th of February last year. That was our test. And again, in QI approach, we did a small test of change between March and April, where 16 people helped us basically to break the application process by adapting it, testing it, and customizing it to the Irish context. Opening membership broadly on May 2020. Through rounds of promotion, journal articles, Twitter, LinkedIn posts, webinars, broadcasts, and target invitations to apply, we now have, slide says 64, but this morning I checked, it's 68 members of Q. But who are some of the people behind the numbers? Because it's how we as individuals connect that matters. So many of you on the call might see yourselves here on this slide. This is an extract from the Q directory, where we can all look each other up. So we have a growing community of people invested in quality improvement, with linkages and connections between numbers. More anon from Matthew on that. A real bonus of being part of the wider Q community is getting to see firsthand what is happening in QI in other countries, in England, Scotland, Wales, and Northern Ireland, and the broader health systems, simply thinking outwards. So this leads me very nicely to introducing Tracy White, Communications and Engagement Lead for Health and Social Care QI in Northern Ireland, a colleague and a friend of the HSE who I first met through Q. Over to you, Tracy. Thank you so much.
Okay, thank you, Maureen, for your very kind introduction. Folks, I'm going to talk to you a little bit about my journey through Q. And I feel that I'm probably a bit of a novice at it still, because I only joined a year ago, but maybe it's relevant for some of you folks who are thinking about joining. And I know that there's colleagues on the call today from HSE who have been Q members for a lot longer than me, and hopefully you'll hear a bit more from them in the breakout rooms. But I joined Q last year and I'm really pleased that I did. I'm fortunate enough to be taking part in a course which Maureen has also taken part in, and Caroline, and it's the Q NetWeaver course, which is a course really that's all about learning about networks, how networks work, how to make networks work better, how do you know who's in your network, who's missing, all the tools and techniques. So I'm hoping to bring some learning back to HSE NI on that. And we hope to map out our HSE QI network. And we're working at the minute with Maureen. I've been very privileged that Maureen and the National QI team have had me in as a bit of an observer on their network mapping planning that they're doing so far. And I know you're going to hear a bit more about that later on. So that's really good for HSE QI to be in the early stages of that, and it will help us to shape what we're going to do going forward as well. I've really enjoyed the connections that I've made with Q. I've enjoyed the events. The Q conference last year was just brilliant. And I love the way Q organise and deliver their events. It's so professional and really good. And there's lots of really good ideas that you can always pick up for your own events when you're part of Q events. And for me and the role that I have in HSE QI, I find that really useful as well. So I'm a bit selfish about my reasons sometimes for coming to the Q events, because I know I'll always get a few good ideas to take away. As a new member, I've also joined one of the special interest groups, and there's an option for you to do that as well. And there's a lot of different groups. One that sort of interested me at the minute, and maybe it's just where we all are with kind of health and well-being and trying to get through the pandemic. I joined the mindfulness group, and I've had a few really good sessions on that, which has been very interesting. Also then we're able to work last year with Q and National QI to deliver the All Ireland Learning from COVID event, which some of you I know were probably on. And again, that was really good to see how that all came together and to see the connections that were made on that. I haven't so far joined a randomised coffee trial. I don't know if some of the Q members on the call today have, but that's probably my next adventure on my Q journey, to join a randomised coffee trial. One of the other things that is of interest, and hopefully some of you may be available at the minute, when you have your Q membership, you have access to a lot of free journals and periodicals, and things like the BMJ Quality and Safety Journal. You have access to the IHI Open School courses. So there's lots of benefits of being a member of Q that connect you in with some other great resources and other organisations. And another good advantage as well is being able to take part and submit a project for the Q Exchange programme. And in Northern Ireland, we have had to date 6 projects successful in that over the last 3 years. So 6 projects that have each secured £30,000 to develop and take forward the project. So that's a useful fund to have access to. I would really just urge everybody who's thinking about it, maybe just hasn't got around to filling in the form, to give it a go. You'll not regret it. You'll make lots of really good connections. You'll have a lot of resources out there. If you're ever looking information or a connection, the Q team are a huge resource for all of that. And if they don't know who you need to, if they don't have the person on hand, they'll be able to signpost you to somebody. They'll know somebody in the network that's working on something that you're interested in, or they'll know about a special interest group or something like that. So it's a really super connection to make with Q, and it'll open up a load of connections for you, for yourself, for your own personal development, for your team, and also for your organisation. So yes, I would totally commend joining Q to anybody who's thinking about it today.
Tracy, thank you so much. fabulous whirlwind of all of the exciting opportunities that are out there from being a Q member. So now it's over to all of our participants, the 58 fabulous people here together with us, to get the conversation going, meet new people and share where you're at. So thank you to Beth and Breffney. With their Zoom magic, they're going to invite you to join a breakout room. There'll be about 4 to 6 people in each room, randomly allocated. So that's the exciting, you get to meet new people. You don't need to do anything. You just follow the instructions on the screen to get there. We'll have about 12 minutes together, not 12, sorry, we'll have about 8 minutes together to introduce yourselves and discuss what do you know about the Q community. Anne-Marie is popping the question in the chat box. You'll be able to see it. You'll receive a 2 minutes alert when your time is coming to a close. It'll go very fast. Don't worry at all if you've any trouble. There'll always be somebody in the main room to help you out. So over to you, Beth and Breffney. Let's whisk us away to our breakout discussions. Thank you. Great. Welcome back, everyone. It's lovely to see all the smiling faces. We just wait just 2 seconds or 3 for everybody to gather. Like the train coming into the station. You can see all the smiling faces in the carriages. So I think that's us all back. Thank you, everybody, for participating in that discussion. Can I invite everybody to put their mics on silent, if you wouldn't mind? That's great. Thanks a million. So I'm absolutely intrigued to know a little more about what you discovered in your conversations. So I'm going to ask you to share in the chat box if you had any surprises about what people know or don't know about Q. So what were your surprises in your conversations? So I can hear the fingers starting to type. Oh, Rowan, that there are still people that haven't applied yet. You're certainly putting it up to everybody. Some people had some connection issues, and apologies for that, in and out of rooms. Any other surprises? Surprised to know that 2 colleagues are applying. Supported education and CPD that's available. Great, Ruth. Just a wonderful chat. Great. And that's what it's all about. It's making those connections. Lovely to hear how much others are getting from Q. The random coffee trials. In our rooms, we were all very similarly placed, joining with looking forward to really engaging fully. Having special interest groups that you can participate in. Thanks, Mary. That's great. So lots of surprises and connections made. So I'm going to bring this part of our session to a close, and it's my enormous pleasure to hand over to Priya Panati from the Q Central team to invite Priya to introduce ourselves and lead us through the next session of our celebration. Over to you, Priya.
Brilliant. Thank you so much, Maureen. And hi, everyone. I'm Priya Banathi, a new member of the Q team, and I'm delighted to host this next section. I'm here with colleagues from the Q team as well as members from Ireland, and we're essentially going to do a quick round of sharing key offers with you that you can experience when you become a member of Q. And we'll follow this up with a breakout room conversation where you can then choose which of the 4 topics we share you'd like to learn more about and ask more questions. So hopefully this will give you a really good flavor of what Q brings. And these are just 4 offers. There's many more that we can get into in the text chat if you have questions about, etc. So let's, without any further ado, let me go ahead and share my screen, and let's kickstart with our first presenter. I'm going to ask Matthew Hill to talk to us about the Q Ireland Network map.
Great, thanks very much, Priya. So yeah, just a quick showcase of the Q Ireland Network map. So we're really pleased to be piloting a new approach to network mapping with you all as part of how Q and HSE are thinking about supporting and developing the Q community in Ireland. So we're using some new software called SumApp and Kumu. Some of you may have heard of it. We're using that to develop a visual and searchable map of Q in Ireland, which will include key details of network members, as well as, crucially, the connections between them. And we think this will be really important for a few reasons. Firstly, and perhaps most importantly, is that we want the network map to be useful for you, so individual map members, so that you can use the information on the map to build meaningful connections with the right people, people who share your interests, share your challenges, and then hopefully use those connections to build really fruitful collaboration, which is obviously what we're all about. We also think the map will be useful for taking a more strategic perspective, I guess, on the network. So it will allow us to better understand the strength and nature of the network, how many people are on it, how well connected are they, who are the key players, are there kind of clusters within the network, and crucially, how can we kind of bridge across those clusters. So for example, we might have a subgroup of Q in Ireland that's really interested in digital transformation, and another subgroup that's really interested in patient and public involvement. Well, the network map will allow us to see how well connected those 2 clusters are. And if they're not well connected, it may inform how we go about trying to connect those 2 groups. Next slide, please, Priya. So just very quickly, it's really exciting, and you can hear a bit more about it in the breakout groups, but just a very quick update. We've now developed the map with a small co-design group to make sure that it includes the right information. Some of you are on the call now. You can see some of that co-design group on the map in the picture on the left. What we're going to do now is invite you all to join the map, hopefully grow it into this really useful resource for you all to help support your work. So hopefully it will sometime soon start to look a bit more like the picture on the right hand side. So we'll be in touch over email over the next few weeks to invite you to join. Thanks.
Brilliant. Thank you so much, Matt. I'm going to now invite Matthew, also from the Q team, to talk to us about liberating structures.
Brilliant. Thanks, Priya. Yes, so liberating structures, which I imagine many of you might have heard of, are a set of kind of very flexible group tools that spread participation around the groups you're working with, to include and engage everyone. They generate new ideas, they allow co-creation, they do a whole range of things. And there are sort of about 3 dozen core ones, but they're always developing new ones and adding them and testing them. And we've had, for about a year now, we've had a Liberating Structures user group that Q members developed, and that's been meeting every month and trying out, is a kind of safe space to try out new liberating structures together, maybe before you use them with your own organization. Sometimes it's good to try them, in a kind of sandbox situation. Yeah, and the graphic there, you can see is just the little icons they've given to all the liberating structures, you know, TRIZ, 1, 2, 4 all. You may have heard of some of them. Yeah, do you want to go to the next slide, Priya? Yeah, and they're just a quick sort of timeline of what's been going on with these liberating structures, and how people are, you know, the thing I haven't said is people are finding them increasingly useful in helping with their quality improvement efforts, in getting people involved in really making them more kind of sustainable and getting strong buy-in. So we first of all kind of dabbled a bit, I suppose. Back in 2017, we had a few small workshops at Q national events, just trying out maybe 1 or 2 liberating structures, you know, min specs, TRIZ, things like that. Then we kind of launched in a bit more fully by offering the first, I think, immersion trainings to, you know, QI and NHS people, with some of the founders like Keith McCandless and trainers Fisher Qua, Anna Jackson. So we had 3 of these big immersions where people just try out, you know, whatever it was, 6, 7, 8, 9, 10 of these in a day without much theory. You just sort of jump in and try them, and likely as not realize you can use some of them in your own work. After that, we had a really good session with Zoe Lord from NHS Horizons at another Q event, with maybe 70 or 80 people, and it was the most highly rated bit of that Q event, or even at that event and the year before. So it was obviously something Q members found really valuable. So since then, other things that have happened, a couple of Q members started the first user group in Scotland to be trying these out together. That's Dan Harley and Kirsty Ellis. And the group we have on the Q website, which now has almost 400 members, so it's one of maybe the 2 most popular groups. And we've hosted people like Juanita Gadera and Rob Cunny, who many of you I think will know, who I think are both based in Dublin, and they've been using liberating structures for maybe 6 years or so now, really integrating it into the quality improvement work and finding it really useful, and learning to not be too evangelical, because that scares people off, you know, these very useful tools. And we also invited back the one of the co-founders of Liberating Structures, Keith McCandless, to do a workshop with that group. So that was great. Do you want to go to the next slide, Priya? And this is just a little a couple of kind of snapshots of the user group. And the last session that we had a week or 2 ago, which was actually led by Priya, we were using something called Discovery and Action Dialogue, which I'd not seen in use before, which is a fabulous tool which helps us discover the kind of positive deviants that are already doing the thing we're trying to do, you know, with minimal resources, and are usually sitting somewhere out in our network, often invisibly. So Discovery and Action Dialogue was a way to find those people, and we did that with a great use of a whiteboard called Miro, and you can see a little corner of it on the right there, and on the left are some of the participants. So yeah, so that's the monthly user group. And if you have any questions or want to get involved or want to try your hand at facilitating in a safe space, do join the chat, the group breakout soon. Thanks.
Great, thank you, Matthew. Let's move on to Cleo, who will talk to us about the Communities of Practice Leadership Development Program.
Thank you, Priya. My name is Cleo Butterworth. I'm the Associate Clinical Director for Patient Safety and Patient Experience at an organisation called the Health Innovation Network, which is the academic health science network for South London. And I'm here to talk to you about an opportunity that's open to Q members, which is the Communities of Practice Leadership Development Programme. This would be our 2nd cohort after a very successful cohort 1 that finished in January 2020. But before I talk to you about the programme, it's probably a good idea to talk about what I think communities of practice are, because they mean different things to different people. And for me, I go along with the definition of the concept developed by Etienne Wenger, that they enable practitioners from different backgrounds with different perspectives to come together across organisations and across hierarchies to meet as equals, to develop potential solutions to those more wicked problems that go beyond what each of us can address in isolation. Now, wicked problems, a term coined by a gentleman called Heifetz, are often very ambiguous, and they're difficult to define and don't really have an obvious solution. They involve multiple stakeholders who often have conflicting priorities, and they cut across our traditional organisational boundaries and our professional responsibilities. Solutions in one part of the system could well lead to unintended consequences in another, and the data that we have is often contradictory, incomplete, or more often than not, not existent. And they're socially complex and require us all to change our behaviour. Now, Albert Einstein famously said, "You can't solve a problem from the same mindset that created it. You must learn to see the world anew." And we can only do this by breaking down our silos and talking to people who are not like us and learning to see the world through their eyes. So to approach these wicked problems that are typically beyond the scope of any one of us, any profession, or any single organisation, we need to come together to share knowledge and learn together in the hope that we will create new knowledge. We can then use that new knowledge to develop potential solutions to the problems that we face. And as these solutions are created and owned by all the members of the community, then they stand a good chance of being translated into action. I think it's fair to say that communities of practice work best where there's trust and people have the opportunity to develop strong relationships, and where people are given space to reflect and think creatively. So that's what a community of practice enables us to do. But this is not an easy space to hold, and it's definitely not an easy space to land in our health and social care world. And so hence the idea of the Community of Practice Leadership Development Programme was born. So it's open to all CUE members, as I said. There are 24 places to participate in the programme that will run from September 21 to September 22. Applications are now open and they'll stay open till the 4th of July. And over the month, participants will spend roughly 10 days, 5 of them spent as 2 virtual half-day sessions, learning to plan and launch a community of practice, build integrity and maintain vitality of their communities, design with communities and with patients, and capture the value of these spaces, and then learn how to grow and sustain communities of practice going forward. So if you want to find out more, come and join us in the breakout room. Thank you, Priya.
Brilliant. Thank you so much, Cleo. Over to you, Zanira. Zanira, are you able to
Yeah. Thank you, Priya. John, would you like to start?
Yeah, thanks, Zanira. So thanks myself and Zanira are just going to talk about Q Exchange, which again is another fantastic Q opportunity and one that we have benefited from. And you know, when we became Q members, it was great to learn that we would be eligible for the Q Exchange funding. And you know, this is an area where it can be difficult to get funding for. And you know, the thing we liked about this, obviously, the funding is there, which is great. That's important. But it's also the whole process, you know, of how we select ideas, and the community helps to shape those ideas. So we put our ideas forward, and then collectively people will comment and I suppose help us to make that idea better. Then we put in a formal application, and Zanira and I were fortunate enough to be successful in being selected as one of 2 Q Exchange projects that were approved for funding. And with Maureen, who's on the call here, and our colleague Aoife de Bruin in UCD, we're doing a project looking at the learning we can take from all of the incredible changes that people have stepped up to make during the COVID pandemic. And Zanira, you may want to just talk about that for a moment and what we've started to learn.
Okay. Thank you so much, John. So our project is around, learning from the experiences of staff during COVID-19. we took a very narrative or a story-based approach. We went, identified stories of good practice of rapid change implementation that were shared on social media. And then we contacted staff and we collected their stories. And another idea behind this was that to give staff a voice and listen to their stories and how we can learn from these stories. So we've presented the findings in different webinars and conferences, and we hope to publish our findings in a peer-reviewed journal very soon as well. So John has talked about how this is one of the many projects, the winning ideas. The other project in Ireland is by Miriam McCarthy, who is based in the University of Limerick. And you can read about all of these wonderful ideas on the Q website. On the next slide, I'll just briefly talk about, our main reflections of the process. So one of the main things was that it wasn't really a very time-consuming or long application process with not, no long wait time. So that was very useful. And the collaborative application process, it allowed us to work with different community members, get their feedback. It gave us, networking opportunities as well and learning from the Q community members. So, and another important point was around the budget template. Budgeting for projects can be sometimes very tricky. So this template made it the process quite easy for us. And we hope that this would encourage other Q members to apply for the funding. And I hope this was useful for those who are considering applying. So thank you so much, Priya. Back to you.
Just unmuting. Thank you so much, Sunira and John, for wrapping up our round review of 4 offers. We're going to take this into a discussion in breakout rooms. And so you can join a breakout room that addresses the topic you'd like to learn more about. So to do this, can you please update your profile name in Zoom by adding the number of the breakout room that you would like to join. So 1, if you'd like to join Matt Hill and talk about the Q Ireland network map. 2, if you'd like to join our other Matthew Mezzi and talk about the Liberating Structures user group. 3, if you'd like to join Clio and learn more about the COP Leadership Development Program. And 4, if you'd like to join John and Sunira and learn more about their Q Exchange project. We also have Tanya Mason from the Q team in the Q Exchange breakout room who can speak to the Q Exchange program in general. Okay, so the easiest way to do it is to go to your video image, click on the 3 dots and choose to rename yourself. So I'm going to go ahead and rename myself and add the name of the room right in front of my name and say okay. And you'll see now I'm one Priya Banathi. So we'll give you 30 seconds to do that. And then Beth and Breffney, when you're ready, please start the breakout rooms and have people move in. Brilliant. I see many of you have updated your profile name. For those of you who are struggling with that, go ahead and put it into the text chat. We're here to help you do that.
You'll also be able to move once you're in the room. You should be able to have the option to change rooms. So I will pop you into a space if you're not there already, and we'll open the rooms in a moment.
Okay, Stephanie, I'm going to move you to room 2. Renamed.
Thank you.
If anyone else is struggling with the rename function, just plot your option choice in the text chat and I'll quickly rename you.
I'm going to open the rooms now, so you'll all be sent somewhere, but you will have the option at the bottom of your screen. You'll see breakouts, and you should be able to change your room if you want to be in a different space.
I'm looking for Ruth. Ah, there you are. And Beth, if you've got Ruth going into room 4. Oh, I think she made it. Brilliant. Good catch. Thank you. Oh, Maureen wants to go to 3.
I'm going to go now. I have a join. I'll go now. Thank you.
Okay.
I'm just checking that everybody was all right. So I'll exit now. Thanks, everybody.
Okay. I think we're almost all back. Oh, 4 more seconds. There we go. Hello again. Welcome back, and thank you for rejoining our main session. I hope you had a good amount of discussion on those specific offers. If for, breakout room durations are always insufficient. So if you had any remaining questions or things you wanted answers to, please put them into the text chat and we'll be sure to respond to them. But now that all of you are back, I'd love to pull up a very short poll just to get a sense around the group as to where the appetite is to do more with Q. So Beth, if we can pull up the poll. There we go. Here's our poll. Please go ahead and respond. 4 short questions. Where would you like to do more with Q? Oh, did the poll just close?
Yeah.
Can we perhaps relaunch it? There we go. Thank you so much. And apologies, guys, for those 8 of you who did, get your responses in right up there. If you could do it once more, and we'll wait till all the responses are in. So 45 of us or thereabouts. Okay, there we go. 24. Oh, and closed again. But there might be something going on with Zoom and a random poll that decides to close itself. So apologize if your response didn't come through. Go ahead and put it into the text chat. We're really interested to hear where you feel you'll be doing, you'd like to learn more and get involved. And it could be any or all 4 of those options. For those of you who are interested in doing something else, apart from the 4 things we talked about today, please put that into the text chat as well. Thank you. All right, so with that, I'm going to hand this over to Amanda for us for the next section.
Thanks, Priya. Hi, everybody. I'm Amanda Vaughan and I work with Laurel Lynn Children's Hospice. And I'm delighted to be here today as I'm a relatively new member of the CUE community. And I'm very excited and intrigued to hear about all of the supports and activities that are available to us. In fact, I think I really want to know about more for all of those options in the category there. So for the next couple of minutes, what we're going to do is hand over to you. We'd like to hear from you in terms of what you'd like to see happen with the Irish community. So if you just take a minute or two to have a think about what are your aspirations for the CUE community in Ireland, how would you like to be involved and how would you like to be supported? And then if you'd like to unmute yourself or just chat, type it to the chat box and participate in the conversation.
Amanda, it's Maureen here. I might get us going by saying one of my ambitions is to double the membership of the community as fast as we possibly can, because it's connecting people together that creates the army for improvement. So we've 68 members now. I'm telling you, I'd be very excited if we had doubled that by Halloween.
Brilliant. Thanks, Maureen. So increasing the membership. So if you haven't applied already and you're on the call today, please get your application in. Olivia, regional CUE groups in an integrated nature. Do you want to maybe come off mute there, Olivia, and tell us a little bit more about that?
Yeah, so I would just be interested in, we were in the group there just looking at the mapping, so kind of mapping around the country and trying to link up with more CUE members in your own area. So like, okay, ideally maybe over Zoom, but it would be lovely to be able to have like a cup of tea with somebody or to meet people face to face. And I suppose just the integrated nature would be just the mixture between acute care or primary care and to try and kind of cross the borders between those to get teams of people together in the one geographical area would be lovely.
Brilliant. Thanks, Olivia. And actually, yeah, the network mapping was something that really struck me as well. Any other ideas?
I wonder, what do people think about special interest groups? One of the things that I thought was fascinating about CUE was that you can actually join one of the special interest groups, even if you're not a member of CUE. To set one up, you need to be a member of CUE or you need to have somebody involved in the setting up of it who is a member, but you can link into the special interest groups without being a member. That was kind of a piece that I felt would be worth exploring for us.
Great, thanks, Caroline.
I had a particular interest actually with the National Staff Engagement Forum. I could see great potential there. So we'd have to see. The cyber attack threw me off track with that.
Amanda, I see Deirdre Lang there mentioning that she might like to set one up.
Oh, brilliant. Deirdre, do you want to say a little bit more about that? Is there a particular area that you'd like to set one up in?
So I wasn't aware of them, so I am going to assume, and we know what that does, that that there will be something around older persons, but I am trying to lead out on the national Get Up, Get Dressed, Get Moving campaign, and I'd love to see something from Q to support that. So that was something that struck me I'd like to do.
Fantastic. Thanks, Deirdre. Any other ideas? I know some of you in our earlier meeting were talking about re-engaging with the community after the busy year that you've had. I'm just wondering, have you got some ideas about how you might do that?
Can I ask a question in relation to the application for Q and the length of time? I think it says 5 to 6 weeks for the application to be processed. Is that correct?
Priya, I might hand that one over to you to answer.
Thank you so much. And I'm going to pass it on to Breffney. It's 4 to 6 weeks as she shared, but Breffney, tell us more.
Sorry, what would you like to know about the application process?
Does it take 4 to 6 weeks? I just want to make sure when I applied, it's the correct one I applied to and everything.
Yeah, so I'd say 6 weeks at the outside. So we basically batch all our applications every 2 weeks. They go out to assessment. So best case scenario, you should hear within a month.
Okay, that's fine. That's grand.
Thanks, Breffney.
Thank you.
I see that Ruth has asked if there's a list of existing special interest groups, and there is, Ruth, on the website, and the address or the link is in the chat box there.
Thank you. Can I just ask, if you're not a member and you go to register, it takes the month, but the module program for the collaboration of practice closes the 4th of July. So can you apply in the hope that you'll be accepted, or do you have to be the member?
Priya, would you like to take that one?
Yes. So it is 4th of July, and it's a really rapid turnaround. So the COP Leadership Program is for members. Margaret, I would suggest go ahead and put your application in, okay, and we'll give it a go.
Do both applications and hope for the best. Okay, thank you.
Thanks, Margaret. Any other suggestions around where you'd like some support or where you see the Q community in Ireland going?
I would be really interested in knowing, actually, say people who are not already members, what might be their reservations in you know, what puts them off, or have they reservations, or is it a lack of time, or how could we make it kind of easier or more attractive?
Great, thanks, Caroline. So any feedback there for Caroline in terms of maybe what's preventing you from applying to become a member?
In the first group, when we had a discussion on this, and a few of us had looked at the application form and didn't have time to complete it and never went back to it. And there was about 3 or 4 of us of the 5 that were in the group that had turned away at the application form.
And I'd probably, you know, agree with that as well. The application form maybe can be a bit daunting if you're not a QI expert.
So may I offer just that if anybody is considering applying and maybe they're being put off by the application form, that they make contact with me, because I'll gladly I'll share kind of my process of applying and help and support in any way possible. There's a hiccup at the moment with our emails are still not back to where they should be, but as soon as we get sorted with that, I'll definitely be available to people.
And can I say, and I'm Breffney, I'm an assessor for applications. Don't overthink it. Just it is actually a simple application, and it is about not overthinking it, not trying to put it down too much. We want to see your passion as much as we want to see anything else. Well, that's certainly as an assessor, you know, I want to see that you want to be part of this and that you want to do this. And what you see Q as meaning to you. So I would just say, don't overthink your application. Make it as simple. Just show what you've been doing. In many ways, the fact that you're applying at all shows that you're wanting to be part of this. So don't overthink it. And
Denise, I agree. Denise, I absolutely agree with you. Don't overthink it. But you just need to see, I'm an assessor as well. I just like to see people's passion. But the important thing is for me is that you actually want to be part of the community.
Yes.
So actually, it's not that you want to take out from Q, it's that you want to put in as well.
Yes.
So it's having the confidence to realize that even if you haven't worked in Q, we all have something in our backgrounds that can give for other people. And we all have got something to give. And even if it's just been a listening ear, or we've all got a sense of curiosity. So I would just say
it's a community as much as it is anything.
Absolutely, it's a community.
Yeah, and so every single one of us has something to bring to the community as well as take from the community. So, you know, always think of it as a community. And so you're applying to be part of something, not necessarily applying, you know, to run the thing. So yeah, that's my thoughts as well. Thanks.
Thanks so much, Denise and Ursula. That's very reassuring. And I see that there's a couple of comments in the chat box there. From Anne-Marie, said maybe to support your fellow improvers to join Q by setting aside 15 minutes to share your own Q application with them, which is similar to what Caroline was saying there. And that there's more helpful advice on the Q website in terms of how to join Q and your application form. Okay, just before I hand back over to Priya, is there anything else that maybe has come to mind while we've been having the discussion around how you'd like to see the community go forward?
Amanda, it's Maureen. Just one final thought is our network map that we just got a glimpse of today, and we are going to be launching that in September, so it'll be available for everybody to join. Tracy mentioned coming on the journey with us, so really a longer or medium-term ambition would be for the map then to grow to be all Ireland. So that's something we're looking forward to.
Brilliant. And the other thing I'd say is also keep an eye on Twitter. Me being new to the Q community, I see quite often there's little lunch and learn kind of webinars about different aspects of Q. And I did one there recently with Tanya on an introduction to the Q community for new people, and it was super helpful. So do keep an eye on those kind of events that are happening as well. So I'm going to hand back over to you now, Priya.
Brilliant. Thank you so much, Amanda. And thank you all for the rich text chat contributions in there in terms of what you're finding useful and not. I'm going to move us forward, so give me a quick second here, to the next section. And here really it's about, how can you keep connected and invested in Q? And we're going to take it at two lenses. The first is really for those of you who are not yet Q members. As you've heard Maureen share, we're really excited to have you join and be part of our community. But if you haven't joined yet, these are three ways in which you can start to connect. The Q website has a lot of our resources, and they're available for you to browse through and pick up new learning and new ideas. We have a regular blog series. My favorite is the where Q members share their improvement journeys. So be sure to take a read through that. And you can also take a look at the improvement tools and skills that we've shared as resources on the Q website, and that's there immediately, really. Next, many of you are super interested in the Ireland's network map. So as Maureen shared, in September when that is launched, do choose to participate in that. It's open to non-members as well. So please do look out for that. And lastly, I wonder if we can, through the chat, create some form of a matchmaking activity where if you're a new member and you want to take a quick look and have a chat with a member around what they put into that application form and reduce how daunting that might feel, then put your name into the text chat and say, new member or, want to be member, looking for a conversation with a member, and let's see if we can make those connections right here. And this is something for you to plan after this event, have that chat and get ready to join our Q community. Okay, so moving to now those of you who are Q members, one of the 64 and growing list of members from Ireland, we thought we would just highlight 3 things that you could commit to doing after this event over the next month or 2. The first is, of course, our random coffee trials. Some of you mentioned it in the text chat. It's a 30-minute opportunity to connect with one other member across the Q community. So do sign up for that. It's an informal chat and a way to grow your network one person at a time. I enjoy and look forward to my RCTs because it's an opportunity to meet other Q members, but also just take a step back and just have a random conversation. I come out of it with, you know, a couple of ideas that I can then take back into the work that I do. The second piece is around introducing Q to your fellow member improvers and to your teams and members in your local networks. It would be great if you could spread the word, speak to them about your journey as Tracy did today, and you know, invite them to be part of the community. And last but not least, we are kicking off a new offer of regular workshops starting in July. July 22nd is the first. This offer is called Community Space, and it's really where we want to bring our members together across Q and start to think about and understand the needs around the recovery of both our staff and services. So we'd love for you to take that opportunity to bring your experience and your ideas to those workshops and see how we can build upon them working with others. So that's Community Space, and that's starting. Our first workshop is on July 22nd. So with that, I'll pause. If there are any questions coming up in the chat box, I'll respond to them in there. But in the interest of time, I'm going to hand this over to Caroline.
Thanks very much, Priya. And I'd now like to invite Dr. Philip Crowley to say a few final words for us.
Thanks very much, Caroline. Very nice session, and well done to everybody for putting it together so well. And lovely to see the specific areas of kind of potential being shared and people participating and learning more about them. Obviously, we've engaged variously with them, many of us already. So I think it seems to me that the potential is massive in this community. We can form, you know, we'll be part of a wider community by being members of it, and we can have our own community within the community, which will be a community that will bring new ideas to the Q community, as well as learn from the Q community. So I think Ireland can contribute a lot to this community, and hopefully we continue to build a membership, but really an active membership. It's not really about numbers, it's about activity. I think we get out of it what we put into it. That's true of most things in life, I suppose. But really learn from each other and spread the learning. I think we're often criticized for maybe learning something, cracking something, you know, improving something, and maybe not sharing it enough with others around our own system and outside of our system. And I think this is a structured way of doing that. So let's try and do that. And it's lovely to see the different kind of offerings that there are there. We're learning around liberating structures. Are obviously Juanita and Rob Cunny both worked within the National QI team, and Juanita will be returning to it, and they pioneered that work with us here in the Republic of Ireland. And I think it's just an example of tooling ourselves up, and it seems to me as well that some of the offerings are very timely insofar as they're things that we should maybe see as a bit of a treat. You know, why not indulge ourselves a bit with kind of learning a bit more around kind of leadership development through the communities of practice, learning maybe about liberating structures, and just expand our skill set, I suppose, to creatively work with the people who we work with and really embed quality improvement across the system. It's like, I suppose I see quality improvement really as, I mean, our approach in Ireland has been to train a lot of people up in quality improvement, to create networks, to to try and create posts that support quality improvement, the diploma that we run with the College of Physicians, and all the training that we do through the school. So it's really about creating a movement, I suppose, isn't it? And this Q community is a wider movement. So let's keep working together to create this movement and really start trying to get a health service that's genuinely focused on improvement and not on failure all the time, not on reaction to adverse events, not on, which has to be done as well, but not that can become overwhelming in the sole activity in the area of safety and quality. Whereas we really need to have a service right across the system from the bottom up, built on people's own ideas, people's innovation. Everybody can improve. It's not just nurses who can improve. It's not just physiotherapists. We work with all different staff groups. Everybody can improve, and everybody can become a member of this quality improvement movement. So let's all keep going. Let's pick ourselves up off the ground, if you like, after a punishing year, and particularly in Ireland, where we were hit by a cyber attack as we were just getting ourselves up off the ground after well, not after the pandemic, but after the heat of the kind of the peaks of the pandemic. So it hasn't been an easy time. So let's look after each other. Let's draw on the strengths of our own community and of this community to support each other, to get back full steam ahead, to support ensuring that the care we give to our service users is the very best possible. And I know we can do that, and we'll all be there to support as well. So listen, thank you very much for everyone for how you organised today. Very positive day, shot in the arm really. And thank you, and let's keep on working together. Thank you.
Thanks very much, Philip. And our thanks indeed to each of you for being here today, and also to our hosts for the occasion. A special thanks as well to all our colleagues from Northern Ireland for all their brilliant support on our Q journey. And it would be much appreciated now if you could just take a moment to put in the chat box www for what worked well, or EBI for even better if. So that will really help us to fine tune any events or that we have in the future. So www for what worked well, and EBI for even better if. And so on behalf of the National QI team, I'd like to offer a heartfelt thanks to all our wonderful colleagues in Q's central team in the UK. Their outstanding help, support and positive attitude meant that we could go ahead today with our celebrational event despite the challenges experienced by the cyber attack. We simply could not have done it without their help and support. So thank you so much. And on that note, we hope that you've enjoyed our time together today as much as we have enjoyed being with you. We hope to see you really soon. Thank you.